We're always keen to assist our friends in the media with information, so I've got a number of experts with me today. Of course, Dr. Andy Robertson, the Chief Health Officer, is with us, who can answer any questions that you might have in relation to general issues around COVID-19. We also have Dr. Paul Armstrong, who led our teams on the ships in the last couple of days. So you might have some questions to him and provide some insights. Dr. David Russell-Weiss, of course, the Director General, is here to answer any questions you might have in relation to the discussions with the private hospital networks at the moment and how they might fit in. So look, thank you very much everyone for coming today. I'd like to begin by thanking all the healthcare workers of Western Australia in our private and public hospital systems, the allied health staff, the support workers, doing an amazing job on behalf of all of us. Today I'd like to give a special shout out to all our workers in the SHIC, the State Health Incident Control Centre. You can see their small SHIC city that's emerging outside. They're doing a great job coordinating the state's response in relation to COVID-19. In particular, I want to give a particular shout out to all those involved in the evacuation of our cruise ships over the last couple of days. The Department of Health, the WA Police and DFS. This was a quintessentially Western Australian operation. And it's gone smoothly, continues to go smoothly, and we're very proud of the work that they've been doing. Today I can confirm that we have 17 new cases of COVID-19 in Western Australia. In addition to these new cases, that we have 27 cases from the Artania cruise ship, 14 passengers and 13 crew, which serves to show just how this demographic is skewing our overall figures. So in some respects, unfortunately, our official numbers will show that we have 355 cases of COVID-19 in Western Australia, because of course those cruise ship passengers will be incorporated into our overall official figures. As this number is made mostly up of travellers, it does not indicate at this stage sustained community spread. In fact, of the total confirmed cases in Western Australia now, 84% are linked to either cruise ship travel, overseas travel or interstate travel. Over a third of our cases, 32%, have been directly related to cruise ships. I'm especially pleased to report that we now have 41 Western Australians who have fully recovered from coronavirus, and we wish them all the very best. Of today's new cases, 2 are from regional Western Australia, 1 from the Great Southern and 1 from the Kimberley. A further 8 cases from today are related to overseas travel, 1 from domestic travel, and 4 are close contacts of these people. 2 of the new cases are healthcare workers, and as you'd appreciate, our contact tracing team, which has been vastly expanded over the coming days, is now actively pursuing all the investigations we need to make sure that we understand the nature of the disease in those particular new cases. As I said before, I want to thank all the people from the Department of Health, WA Department of Health, Police and DFS, who have demonstrated outstanding capacity and in decanting all those passengers off those cruise ships. Look, they've demonstrated they're amongst the best in the world, and that's why we are confident that we can meet all the challenges of COVID-19 in Western Australia. Just returning to our current caseload, 6 are in Fiona Stanley, 4 of those are in ICU, by definition in critical condition, and 2 are in the other Fiona Stanley wards. 29 have now been transferred to Joondalup Hospital private facilities. 3 are in Midland. Now the 3 in Midland will remain in the Midland campus. They'll be transferred to the private wing of St John of God in that particular facility. And we currently have 3 in Sir Charles Gardner Hospital. So this afternoon we'll transfer the 2 in Fiona Stanley Hospital and the 3 at Sir Charles Gardner Hospital to join those other patients at Joondalup Health Campus. I just want to make some comments about our testing regime. As you know, we have 3 particular objectives with our testing. We want to find new cases, we want to protect the vulnerable, and we want to understand the spread of the virus within the community. We have also, over the last 10 days, been undertaking intensive scans of GP panels which have been sent in for influenza testing. We've been doing extra scans of those for COVID-19, and I'm very pleased to say none of those tests have come back positive. But we're going to go one step further today. Over the coming days, we will open our COVID-19 clinics to the wider community, to those members of the community who have a fever and a respiratory illness, acute respiratory illness. This is because, obviously, as you'd expect, the number of people coming from overseas and domestically is now starting to dwindle. So we're going to expand our testing regime to take in this extra cohort, that is people from the broader public who have a fever and a respiratory illness, to make sure that we continue to have good line of sight of people in the community suffering from COVID-19. This is on top of the work that we're currently doing around any domestic or international traveller with a respiratory illness being tested if they've returned in the last 14 days. We're also, of course, testing their close contacts and anyone who is a close contact of a proven COVID-19 patient. And of course, any healthcare workers or police officers who have a fever or respiratory illness, that is a fever or a respiratory illness, will also continue to be tested. This is also, of course, in addition to the other testing that's ongoing, which gives us line of sight of people in vulnerable populations, aged care facilities, boarding houses, any detention centres, but of course also to make sure that we're keeping a good line of sight in terms of these sort of facilities. So that's pretty much the wrap up in terms of the new cases for today. I'd now like to hand you over to Dr. Andy Robertson for just a round up in terms of what's happening in the world of the Chief Health Officer.
Thank you, Minister. So we continue to obviously, as the Minister has stated, we continue to do the testing fairly extensively across the system. The 44 cases, including the 27 cases from the Artania today, are indicative of that kind of testing regime. We're literally still doing 700 to 800 tests per day. What's interesting is that over the last few days, the number of actual new cases has actually dropped, and that has continued to fall. So we had 23 new cases, and I'm excluding the Artania cases because they're obviously had to be added to those, but we've seen a continuing drop of new cases. That is part of the reason that we will look at expand testing, just to ensure that we are picking up cases that might be in the community. But we don't necessarily believe that's the case, but we obviously want to make sure that that is the case. Even looking at our influenza-like illnesses that are presenting at our hospitals, into our emergency departments, although the numbers have been increased over the last 3 or 4 weeks above the normal average, they are still, very few of those are actually being admitted, and it's fairly much consistent with what we'd see at this time of year. So there's no indications for those presenting in our emergency departments that we are seeing additional illness. But we still need to do that increased testing to get a better understanding of that.
Dr. Robertson, just to clarify the new testing criteria, does someone have to have a pre-existing respiratory illness, or do they just have to be experiencing acute respiratory illness at that time?
It will primarily be acute respiratory illness and a fever at that time.
What do you attribute the drop in cases to?
The drop in cases is, what we're attributing it to is all of the measures that have been put in place. So the measures, the border control measures that have been put in place, the measures around social distancing and the measures around mass gatherings are starting to take effect. We anticipated they would, but it's obviously going to take some time. As you can imagine, that they will come into effect, and to see the real impact of them will take up to a week to 2 weeks before we see that impact. And I think having seen those measures now in place in some form for now about getting on to 10 days, we are starting to see those impacts, particularly in those states that don't have established community spread, and even in across the country. The early signs are that we're starting to see reduction in cases. What we're not seeing is the doubling of cases that people would predict. And there's been a number of predictions that we would be have far more cases at this stage than we do have, and that is, I think, largely due to some of these measures. And we also, to pick up on one further point, it's also around the very diligent case identification and contact tracing that goes with it, making sure we identify all of those people, that we make sure that they are the close contacts are self-isolated at home, and so that prevents the further spread of the disease.
Does there remain concern that the flu season will still overlap with cases of COVID?
Look, it's very hard to predict when the flu season will arise. So the flu season, as you'll be aware, we had an early flu season in 2019. We'd anticipate that we may have the normal time, which will be sort of June onwards, but it's a bit hard to predict. There is a possibility that it may still overlap with a rise in cases, but it's probably still a bit early to tell.